Hello, everyone. Warm welcome. Thank you for joining this panel session. I'll introduce myself. I'm Professor Christopher Millett from Public Health at Imperial College in London, and I'll be moderating the session today. I'm joining you today from the University of Brawijaya in Malang in Indonesia. And the title of our session today is Mobilising Communities for Environmental Action and Universal Health Coverage, Building Resilient Health and Environmental Partnerships. So I'll make some brief remarks before handing over to the panel who are asked to introduce themselves. I'm here in Indonesia in my capacity as the co-principal investigator for the NIHR Global Health Research Centre on NCDs and environmental change, which seeks to address the dual threat of NCDs and climate change in LMICs, including through health system strengthening. I'll say a bit more about the centre in a moment, but before that, I wanted to define UHC, Universal Health Coverage, and set up the discussion with some thoughts about how climate change and UHC may be interconnected. So what is UHC? UHC is the idea that everyone can access high-quality healthcare whenever they need it without facing financial difficulties. And it has three main dimensions. Firstly, it means that individuals have the right to essential health services. Secondly, it protects people from falling into debt due to medical expenses. And thirdly, it emphasises the importance of providing adequate and effective healthcare services. How are climate change and UHC interconnected? So I'll discuss that interconnection both in terms of climate change mitigation and climate change adaptation. So in terms of mitigation, I think health systems can take many actions to reduce greenhouse gas emissions, which can also help us achieve UHC. These include locating more services in community settings or delivering these remotely through telehealth. These actions will both lower environmental impacts of health services, but ensuring that we reach all populations needed to achieve UHC, especially harder to reach groups potentially. Another action we can take is to eliminate low value or low quality health activity, which does not benefit health and can be wasteful in terms of natural resources which are used to produce this. So it could be a low value drug or procedure. And having a strong focus on prevention and health promotion in our health systems is another important pathway for UHC and climate change, as healthier populations have lower need for healthcare, meaning that health systems are more likely to be financially and environmentally sustainable for all. In terms of climate change adaptation, as the frequency of extreme weather events such as flooding and storms and heat waves increase, we need to build greater resilience into our health systems to guarantee universal access to health services maintained during these events. Includes access to vital services, continuation of supply of medications, and health advice. And for example, the importance of protecting pregnant women, elderly, and other vulnerable groups during heat waves is an important thing we need to strive better to achieve. I wanted to touch on the distinction between UHC and PHC. And if we have the slide now, please. I think this slide usefully speaks to why strong primary healthcare is vitally important for achieving UHC and the Sustainable Development Goals. Firstly, we know that from strong international evidence, including from many LMICs, that countries with strong PHC systems deliver more efficient, affordable and equitable care, and that these have the greatest population reach, all fundamental components of UHC. So the key message here is there's no UHC without strong PHC. Secondly, that if countries adopt a comprehensive PHC model as envisaged in Alma Ata in 1978, then they're not only better placed to achieve SDG 3 of good health and well-being, including UHC, but they're also better placed to achieve many of the other non-health SDGs, because both multi-sectoral action and community empowerment are integral components of the PHC model. So we move over to the next slide, please. So the work of our NIHR Global Health Research Centre is really relevant here because we've adopted the WHO Comprehensive Model of primary healthcare to frame our thinking about the intersection between climate change, health systems, and non-communicable diseases. And this includes multi-sectoral interventions in each country, which are focusing on dietary diversity in India, water salinity in Bangladesh, and plastics burning in Indonesia. The Centre has a strong emphasis on community empowerment through co-production of interventions and mobilisation of knowledge with communities for policy impact. So let's move on to the panel discussion of enough, but I'll briefly cover today's objectives and some housekeeping. So our objectives for today are to convene experts in public health, environmental change, and community empowerment to discuss action-oriented steps to for effective community participation for environmental action and universal health coverage. And we're fortunate to have a great panel to discuss this. We want to also reflect on the 28th Conference of the Parties and whether it created an enabling environment for inclusive participation and decision-making. And we want to learn more about innovations in the NCD-climate intersection ecosystem, including opportunities and challenges within community engagement strategies adopted elsewhere, which can be leveraged and scaled up. So housekeeping. The event is being recorded and will be available on demand post-event. For our participants online, please use the chat function to ask any questions to our panelists. We'll certainly do our best to address them in the Q&A segment of the event, but obviously we're maybe unlikely to get to everyone. And that this is a hybrid event with partners from our NIHR Centre attending in person. So we'll also do our best to address questions posed in the room, as well as online persons to contribute questions via the chat box. So I'll ask each panelist to introduce themselves in turn and ask them if they could give a quick reflection on their participation at COP, if they actually did indeed attend, and reflect on a couple of questions. Did COP28 create an enabling environment for inclusive participation and decision-making? And secondly, did the first ever Health Day include commitments which may make UHC a reality by 2030? So I'll move over to, or ask Katia to speak first, please, and to introduce yourself. Thank you.
Hi, everyone. Just to very quickly introduce myself, my name is Katia, and I work as a program director at the International Youth Health Organization, which I also represent in the WHO Youth Council, which has been for the very first time established about a year and a half ago. So we are currently reaching sort of the end of our mandate. And in the WHO Youth Council, I also work as the co-chair of the Working Group on Climate Change and Health, which is also the reason that brought me to COP. So maybe just to kind of go into my experience here at COP. I have been here for almost 2 weeks now, and we have actually seen quite big strides when it comes to the advances in terms of health. And we are seeing with each year at COP, we are seeing larger numbers of youth and children also being more and more represented in more meaningful settings than ever before. So we are seeing progress in terms of this. Maybe to just kind of go through my experience and also to talk a little bit about meaningful youth engagement at the ground, what has been happening at COP. So as Christopher said, we have seen the very first Health Day commence here at COP, and it has taken 28 COPs for this to happen. And this is also the third year that WHO has hosted a health pavilion at the COP as well. So health has only been present in a very formal setting for only a few years now, even though the efforts of the health community reach way further, because we know that WHO representatives have actually been engaging since COP1. So we are seeing, big advancements when it comes to this. And in terms of the Health Day, it did bring us a lot of new developments, including the Climate and Health Declaration, so the very first one of its kind. And it currently has, if I'm not mistaken, over 135 signatories of member states across the world. With 123 of them actually signing the declaration before the COP even started, and the others endorsing it later on. We have also seen over $1 billion of dollars being committed to climate and health initiatives when it comes to climate change at this COP. So we are also seeing certain monetary commitments, but we also, of course, know that this is just a drop in the ocean of what we would actually need in terms of resources to make a meaningful change as we know it today. So going from this Health Day and maybe reaching a little bit into the youth engagement side of things, because youth has been at the forefront of climate action
We lost your signal. Can you hear me?
COP for the longest.
We just lost.
Sorry.
We just lost you briefly. Continue on, but you cut off for a bit. Yeah.
Sorry. Yeah, the internet might not be the best because I'm still here at COP, so apologies for that. But yeah, as I was saying, the current young generations are actually the ones that will be living with the decisions that are made or fail to be made at this COP for the longest. So that's why it also matters the most, and that is why we're also being very vocal about it. Basically, what we have been seeing in terms of meaningful youth engagement in the spaces at COP is that beside having the second sort of formal youth position, now this time around in the form of a youth climate champion that was proposed by the presidency of UAE, but we have also seen a very big development in the form of the Children and Youth Pavilion, the pavilion of the Youth Climate Champion, where there have been events happening every single day with hundreds of youth actually being engaged, being offered the opportunity to present their work, share their experiences and their life stories, learn from each other, but then also to influence the happenings here at COP. At the same time, in terms of health specifically, we have seen many groups of young people actually also engaging with WHO and the Health Pavilion, which means that they have been both integrated into the panels that have been happening here, but then also organizing side events on their own. One such side event is actually happening tomorrow as kind of the final activity at the Health Pavilion and is being hosted by the WHO Youth Council. So all in all, we have been seeing a lot of progress. However, youth are unfortunately still not having a representative voice when it comes to the actual negotiations. So we're taking a lot of measures that are available to us and spaces and platforms that allow us to raise our voices. And especially this COP, this means in the forms of either demonstrations, live actions, flash mobs, and so on, to also influence decision makers. Youth has been super active also in hosting bilaterals with different member states to provide input on what the member states are advocating for. But we are seeing that the progress in certain areas of negotiations has actually stalled. And as youth, we would like to see more advancements, especially in the field of mitigation, adaptation, loss and damage, and so on. But as said before, in terms of just having a representative voice is currently still very difficult, and we are working towards it. But generally speaking, just looking at the history of COPs, just reaching the COP28 and seeing the level of youth engagement that has been here, especially in the form that it was meaningful, also celebrating the Youth Day on December 8th, it is something that that holds historical value and that will be providing a new platform and a new basis for which youth engagement can kind of lean on when we go into COP29 and COP30 in the next years. So maybe this was just in general something about COP. Yeah.
So we can pick up on that again, I think, in the broader discussion. So thank you for that introduction. And so I'll move on now to Susan, please. If you could introduce yourself and give some reflections on those two questions, please.
Good morning, everyone from my end. I hope you can hear me.
We can hear you perfectly. Yeah, thank you.
All right, thank you. My name is Susan Onyango. I work in the health department, Homa Bay County, and that is in Kenya. I'm also the director and CEO of NutriCare Family Center that provides nutrition services. And in the community where I serve, I founded a project called The Healthy Woman. And this project is targeting the women and girls. And it's also the project that won the WHO NCD Lab Award in 2022. So it's the healthy woman because when a woman is healthy, then the entire society is healthy. So I'll be glad to share more about this project in the upcoming conversation. And I'm glad to be here as we share several things in this platform. Thank you, and over.
Thank you, Susan, for that introduction, and look forward to your following discussion points. And we'll move on to Sveta, please.
Hi, my name is Shweta Narayan, and I'm the climate and health campaigner with Healthcare Without Harm. I'm based out of India. My organization, Healthcare Without Harm, primarily works with the health sector in ensuring that the sector's own environment and climate footprint does not hurt the people and the environment. Health sector is a leader in climate action. Now, for me, this was the first COP. I have been following COPs in the past, but this was the first COP that I attended. And it was, as Katya said, it took 28 COPs to finally recognize how important health is in the context of climate change and climate crisis, and the fact that the climate crisis is a health crisis. We had a historic first health day. And just echoing what Katya said in terms of the declaration and the commitments to funds. I think from my perspective, I see this as a very necessary and important first step in making, in sort of breaking the silos between climate, the climate crisis and its impacts, and sort of bringing health at the center of the crisis. It's also a remarkable moment because it's important to understand that climate crisis is not a technical problem, it's a human problem. And the first ever health day actually, registered in the minds of people and humanized the whole, it was a first step in humanizing the crisis itself. I was speaking to some of the attendees who had been there in the previous COPs. And for them, one of the remarkable difference was that in the past COPs, health was, there's been a health pavilion that WHO has been mostly talked around in the pavilion, but this was the first time that health was being talked outside the pavilion in the plenaries. Every country that sort of took the stage did mention the word health, did allude to the fact that the crisis is costing people's lives, and the negotiations need to focus on making sure that the climate actions align with saving lives. So this was like a shift that I would say was very important. The first ever health day is a great progress, and I'm very conscious of saying this as a progress, because I think for us in the health community, the success would be about when health actually gets deepened and in sort of ingrained in the negotiation, and when countries and negotiators negotiate actions with health as a fundamental consideration and not just as a co-benefit. And we still have work to do for that. The commitment to finance is again very encouraging, but it's also we must keep in mind that this finance should be additional and new finance and not coming at the cost of other priority areas in climate action. Finally, I think we still have a lot of work to do in terms of, while it's important to build health resilience because of the crisis, I think it's quite clear that we cannot adapt our way out of this crisis. So we need to look at the root cause of the crisis, that is fossil fuels. And again, the health community played a very, very fundamental role in amplifying the role of fossil fuels in causing this crisis. And last month, health leaders representing more than 46 million health professionals called on the COP28 presidency and the world governments, urging them to commit to an accelerated, rapid, just and equitable transition away from fossil fuels towards clean and renewable energy. So I think not just from the context of Health Day, but the health community has played a very, very significant role in helping shape which way the climate actions should take, how it should be just, equitable, and ensure that no one is left behind. And for me, that's a big, big success. And it's just it's a moment to kind of make us recognize that there's a lot of more work to be done, and a lot of engagement to be had in the course of the next few COPs.
Wonderful, so thank you for that, and sounds like there's grounds for optimism, which is tremendous. But clearly lots of work to do. So now I'll hand over finally to Christine, please, to make an introduction and some initial remarks, please.
Hi, good afternoon, everyone, or good morning, depending on where you are. It's a pleasure to be here, and I'm Christine Boso, Senior Lecturer in Global Population Health at Imperial College London. I've recently returned from COP28, and it has been quite a success, I would say, for the health community. As many of our panelists already have stated, it was the first official health day. In fact, in the past, there have been various events organized by the health community at the previous COPs. And I guess the closest to having a health day in the past was the COP23 in Bonn, with the Fiji presidency, where Arnold Schwarzenegger was talking about all sorts of health impacts of climate change and the health impacts of air pollution. But of course, what we had now was a lot more and much more prominent. So the health day at the COP started with the recognition of health as a major issue for climate change that needs to be considered both in terms of mitigation and adaptation. It was an official presidency event chaired by the COP president, with John Kerry speaking and Bill Gates joining and many others. And towards the end of the day, we also had the first ministerial meeting at the COP. So about roughly 50 health ministers across the world attended the meeting in person, and many more sent their delegates. And the meeting essentially was held by WHO giving 2 minutes to each of the countries to make a statement about their commitments on climate and health, which could include decarbonization of the healthcare sector, but also how are they planning to make their health sector more resilient. And of course, some countries went beyond that, talking about also intersectoral action and what will be done beyond the health sector, which was quite an effective way of doing it. As previous panelists mentioned, the health declaration is now there, and it has been signed by around 130 countries at the moment, if I'm not mistaken. But the signatures will hopefully trickle in further. Overall, the health declaration is non-binding, and it is a fairly general agreement, which does mention universal health coverage and a few other things. What is going to happen further is, I guess, more practical action and how things will be taken forward. The WHO has established an initiative called ATTACH, which aims to kind of bring a lot of these commitments into practice, and ATTACH stands for Alliance for Transformative Action on Climate and Health. So this is about net zero healthcare systems and about more resilient healthcare systems. And at the moment, there are 79 countries who have committed to the attached framework. So you can see the numbers drop from the number of countries that have committed to the health declaration to the actual implementation steps. Hopefully, we'll get to see these numbers rise over time. But of course, implementation is a big question for us. And as previously mentioned, at the moment, there's a number of $1 billion committed for initial solutions to climate and health problems, which is an absolutely funny number. And most of that 1 billion consists of existing funders' commitments to funding research and innovation in the space that we've known for some time. So a lot is to be done in terms of also financing, and some discussions have been held about how do we finance health system transition to adapt and mitigate climate change, but also essentially how do we leverage finance, not just from the multilateral organizations, but also involve private funders and create mechanisms that allow sustaining funding in this space for a longer period of time. Nonetheless, the whole event and messaging was much more promising. If I remember back at COP in Paris, the WHO was showing a wonderful pie chart of all the climate financing, and health was sort of a couple of percentages of all climate finance. So now we're very much hoping that that fraction is going to increase and things will move into a way that is much more considerate of health concerns at COP. So these are some initial insights. Thank you.
Wonderful, thank you, Christine. So that's great that the panel have all introduced themselves and those initial reflections. So now we'll enter into the panel discussion proper and then the Q&A. So now we're going to ask each of the panelists for a 5-minute intervention to speak for 5 minutes, followed by approximately 15 minutes Q&A. So, the panel has been asked to prepare around specific questions, individual questions each. So Kathy, I'll start with you again, if you're ready. So your questions were, can you share your insights on effective strategies for meaningfully engaging with young people for achieving environmental action UHC? So you began to touch on this in your introduction. So have you got any further points there? And how would you define an enabling environment for inclusive participation and decision-making? Over to you. Thank you.
Thanks again. So let me just first start off with the point that there are indeed many ways on meaningfully engaging with young people. And it really depends on which way you choose, depending on what you want to achieve, but also what is of interest and of the actual young people that you are engaging with. Because the whole point of actually having meaningful engagement is to actually co-create a process together with youth. So that means that the idea and initiative has to come from both sides. In terms of the topic, so the UHC and environmental action, we have, interestingly enough, at this COP, having seen that UHC was actually being discussed in some of the text, kind of as a good practice examples, providing room for indicators and so on. But as said, negotiations are still ongoing. So kind of going into the creation of meaningful youth engagement opportunities, and then that also then leading towards enabling environments for inclusive participation. So the first thing is just having an honest and open conversation with the youth constituency. And that does not mean just consulting with them, but actually actively listening to their needs and to their wants. And the more voices you listen to, the better, because that means that representativity is ensured. What we have been seeing is that the youth community is extremely varied, not just in the sense of different ages and different generations being overlapped within the demographic, but also seeing a lot of subgroups, subcultures, and then seeing, for example, youth that come from indigenous communities, youth that come from the LGBTQ communities, youth that are people living with disabilities and so on. And we have to make sure that all of these voices are equally represented and involved in the whole process. So in terms of the meaningful youth engagement, so as one good practice example, I would like to highlight exactly the establishment of the WHO Youth Council. WHO, as we know, this year has celebrated 75th anniversary. And last year, we actually have seen the first establishment of a WHO Youth Council. We have been seeing sort of more and more efforts from the side of WHO to involve youth in the past couple of years. But last year is when it all culminated in the establishment of this new body that kind of works not necessarily in just a consultative role, but reports towards the multilateral partnerships division, as well as Dr. Tedros himself. And we are engaging with WHO on topics that really do matter to youth, because we are representative youth organizations that work in the global space. So currently, we have 5 working groups. And why am I discussing this? Is because WHO actually let us have free reign of how we choose the topics that we work on, what we want to do. And then what we have is we have focal points in WHO departments with whom we actually then coordinate the actions and make sure that the WHO work as well as our work reflects on each other and kind of supports both of the initiatives. At the same time, we are also working on providing more meaningful engagement opportunities to youth within WHO. But obviously, just talking about meaningful youth engagement is not necessarily only limited to the spaces that are provided by the World Health Organization, because meaningful youth engagement is something that needs to be considered from the grassroots level to the top level, and seeing how it can be integrated with different existing entities, bodies, decision makers at all of these levels to really make sure that the youth voices and the needs are actually reflected in the policies, as well as in the creation of environments that the young people actually live in, so that it reflects the local, the national reality, and so on. So with this, if I now kind of go towards the second question of how can we actually create an enabling environment that will now lead towards inclusive participation as well as decision making. As we know, especially in the terms of like health and environment, because both of these are very strongly interconnected. So it's almost impossible to think about one without another. And that is also kind of the first point that needs to be reflected in our mindsets going forward when we're trying to establish enabling environments. And the first thing is obviously just emphasizing the critical importance of inclusive participation and decision-making in which young people have a space. And by a space, it's not about having a separate table where youth discusses separate issues on their own without the involvement of decision makers, but it's about figuring out ways how this table can be co-joined to the, actual, and I don't really like this term, but it's often used, the adult table. But it's actually just the table where decisions are being made. And youth needs to have a seat at that table and not in a separate space. And all of that needs to, of course, happen in the pursuit of environmental action and UHC. In terms of just our planet, because we are currently facing unprecedented challenges and the health and well-being of our communities are at stake. And youth are, of course, some of the people that are feeling this the most. So it is imperative that the decision makers really harness the energy, innovation, and passion of young people to make sure that these pressing issues are addressed. And the first step towards enabling environments is education, because it is the key to empowerment of not just youth, but also of educating the decision makers and the people that are creating the enabling environments for youth, in order to make sure that they are really aware of why inclusive participation is important. And whether we call that organizational learning or anything else, it's about ensuring that the young generation, but also the older generations, are really well informed how the intricate relationship about meaningful engagement really works, and also how to address that in the sense of environment and health. So having comprehensive education programs, raising awareness programs, even training sessions for decision makers, we can make sure that we equip both sides with the knowledge to really understand the challenges that we face and see what kind of spaces are needed in order to make sure that youth are able to be proactive agents of change. The next point is then also access to information. And this access to information is often more limited on the side of youth, where it's extremely vital that youth has the information that will allow them to meaningfully engage. And having this information be easily accessible, either through the use of technology that can play a pivotal role, but then also engaging young minds on social media through different virtual discussions, other digital platforms. It's about raising their knowledge level to the one that will enable them to discuss with decision makers about equal measures. However, this information and knowledge alone is, of course, not enough, because with all of this, we now still need to actively involve youth in the decision-making processes. And while establishing youth councils and advisory groups will provide a platform for the voices to be heard, but that does not necessarily ensure that the policies, when they are being formulated, are actually representative of the diverse perspectives within the youth community. So we need to make sure that through this capacity building and fostering of leadership skills, the young people can take leadership roles in shaping the future of our environment and health systems. And this kind of leads me to kind of one of the last points, and that is that we need collaboration, because we need partnerships between governmental bodies, NGOs, educational institutions, youth-led organizations, and so on, to really make sure that we create synergies and that we also create different platforms and enabling environments that are actually there in order to address the issues in a way that reflects the most as to what a certain issue actually needs. Because for one issue, it might be enough to have a youth council or to have, you know, a youth climate champion or something like that. But talking about, for example, UHC, maybe we need to enable an environment to take on a different form. And that is kind of like the beauty of meaningful youth engagement, is that it's supposed to be dynamic. It's supposed to be able to address the challenges you know, on the go, and really make sure that it addresses the needs as they are, you know, essential. So the channels established for the youth to really express their opinions and concerns and suggestions just needs to be in line with what the issue really needs. So it has to be kind of like a two-way street in order to make sure that the policies and the spaces really remain responsive to the evolving needs of the youth community. So all in all, just to have an enabling environment, just to conclude in one sentence, is that it's not just to recognize the invaluable role of the young leaders, but it's asking them about the needs and making sure that when people embark on this journey together, it is really something that that reflects what the issue at hand really needs.
Thanks. I'm sorry to cut you off. I just want to try and leave some time for some questions, some Q&A. So really great insights. Just a reminder that we are taking questions, and do send these through the chat, and we'll do our best to get to them. So I think we're going to move on to Susan now. So Susan, the questions we posed to you were, can you tell us more about the Healthy Woman Project? And key learnings from your work with communities to address unequal gender roles, gaps in integrated services in primary healthcare, unhealthy food systems, and limited health literacy in Homa Bay, Kenya. So there's quite a few issues for you to consider there. Thank you.
Thank you once again. I'm glad to share about the project called The Healthy Woman. this project we co-created with the community, and as I said, in the heart of COVID-19 in 2020. So this project initiative kind of addressed, it is a multi-pronged approach that addressed very complex issues in the community. And one of them was unequal gender roles in agricultural land access and use. And this is a major problem in many societies. So we used male involvement to drum up support and to help empower women just to make decisions on land use and even the crops to put in the farms. Another one was gaps in integrated services in primary healthcare. And you find that most of our programs are siloed. We work in silos. We have vertical programs. Sometimes people say, I'm in malaria program, I'm in HIV, in NCD. So we used task shifting and task sharing, and we ensure that we build the capacity of healthcare workers who have less health qualifications to help with this. And we also use differentiated care model, and especially for those who are on antiretroviral treatment. So we were simply bringing treatment closer to home. Then we were also dealing with unhealthy food systems. And here we employed agri-nutrition, whereby we had climate resilient short maturity crops. And we encouraged the community to continue with their ways of organic farming. They were doing this and coming up with ways that were passed down from their forefathers, like coming up with pesticides, crushing the paper from the capsicum family, and it was working perfectly well. So we did not want to, we wanted to respect that and carry on. So there was also limited health literacy. And we realized that there was low-level knowledge, and the community guided us that what was quite limiting was limited knowledge in NCD risk factors. And therefore, we tailored key messaging revolving around NCD risk factors, and we used WHO materials to help us develop the key messages. So those are the four major areas that this project was dealing with, and helping me to move to the next questions of the key learning of community engagement. So this project, actually, we've seen tremendous improvements in those areas that I've mentioned, including improved household food security, improved knowledge on NCD risk factors, and many more. So we find that community engagement enable us to actually identify the needs, aspirations, and visions of the community better. And it helped us to carefully map out their needs. It was very useful in designing this appropriate program. And by this, we've also realized an increased trust from the community. There's increased acceptance of decisions and commitment to these outcomes. And these initiatives are also cost-effective, and it reduces this cost reduction in healthcare. There's also a greater sense of community ownership. And by this, I see the women, they feel that they are able to contribute meaningfully to the activities, because we did capacity building, they are empowered, and they're even able to give their voices in meeting. This is what we want. And I can say that this whole concept just drives transformation and in the health agenda. So I would say that community empowerment actually involves early engagement, capacity building, and building their leadership so that they gain leadership skills. And the engagement is good in all steps of programming. So it's all in this act of respecting, enhancing, and encouraging the people to meet their needs and aspirations in a more informed manner. And I find that it ultimately builds deeper and stronger and more trusting partnerships between the community and the public. So community engagement, it's very important in driving the transformative health agenda. Thank you. That's about the project, and back to you.
Many thanks, Susan. Terrific. So we'll move on to Sveta. So questions we pose to you are, is the comprehensive primary healthcare model the right vehicle for achieving universal health coverage while protecting vulnerable communities from the harms of environmental change? And do you have examples of where this has worked well? Thank you.
Thanks, Christopher. And I mean, the answer to the first part of the question is a no-brainer because it's a yes. I think the primary health centers are absolutely pivotal in ensuring that there is a just and equitable access to healthcare to every person in the community. They're the first points of contact for community and the health systems, and they're really, really important fundamental pillars in the health system delivery mechanism. Now, just in context, given that we're talking about environmental and climate crises that we're facing, I think it's really important. The PHCs have a really important role to play, and more importantly, what is needed is not just strengthening of PHCs, but also which we have been seeing in the climate resilient health systems framework, but it's also important to kind of reevaluating and recalibrating our PHCs in a manner that they serve the needs, the emerging health needs of populations, especially vulnerable populations in the context of climate and environmental crises much better. So, I mean, we have, and examples that come to my mind, given that I'm based out of India and I work very closely with the subnational governments in Kerala and Chhattisgarh, are examples that I can see in context of air pollution and in context of extreme weather events, what the systems in these two states have particularly done. So, when we talk about air pollution in central India, and I mean, right now, it's a severe air pollution crisis that the whole of South Asian subcontinent is facing. But in the subnational, in the state of Chhattisgarh in India, where air pollution is a major crisis, we've seen that it's the community health workers and the PHCs that have sort of been at the forefront in not just taking care of communities and protecting them from air pollution, but also sort of engaging with communities to bring about a shift, a behavioral shift, and also a sort of collecting data and evidence that would influence policies to protect people and to reduce air pollution. So we have seen that work really, really effectively in context of Chhattisgarh. And what again, in that context, the primary health centers became the vehicle of information, and they became the sources of the care that community expected when they were facing a severe air pollution crises. So in that sense, as I said, that PHCs are sort of the first point of interaction. The evidence that PHCs sort of gather become very fundamental in shaping policies for the state or the country, and sort of addressing health problems and especially health inequities. We must also remember that it's the poor and the marginalized who will be worst affected when it comes to environmental crises or climate crises. And extreme weather events, again, would be something that we need to kind of look at, and because they directly affect the health systems and health delivery. And we know that in times of crises, it's the health systems that are needed the most. But unfortunately, the trend that we are seeing, especially during floods and landslides and cyclones, is that the first institutions and first systems to collapse are the health systems. So when people need health systems the most, they're not available. And that again goes back to sort of strengthening health systems and strengthening the primary health systems in a manner based on the topography, based on the vulnerabilities that each geography has, and building them in accordance to those sort of climatic conditions so that they are functional and they serve people when their services are needed the most. And in that context, I would say Kerala is a great example for that, because in 2018 there were massive floods which completely rendered the health systems quite ineffective and useless. And the collective health, the system, the infrastructure damage that we had witnessed was sort of unparalleled. And many health facilities completely were destroyed. And during the rebuilding of those health facilities, and especially the government's vision about sort of building the primary health facilities was keeping in mind the flood and other climatic vulnerabilities in consideration while rebuilding. So effectively after 2018, when the health systems are being rebuilt and expanded in the state, they are taking into consideration local climatic conditions. As a result, in same spots where health systems were completely decimated in 2018 floods, subsequently in 2019 and 2020 rains, and during COVID, we saw that systems survived. Not only did they survive, they thrived, and they were like anchors for community resilience. And all of this was, so just one final point is that while we're investing in buildings and infrastructure, it's also what makes the difference in effectively reaching people, the health services, is the community participation and the health workers. And these are the two fundamental sort of foundations that cannot be ignored. What, in my opinion, the crisis that we're facing right now is an opportunity to transform the way we see our health systems. Our health systems cannot be building infrastructure. While that should be strengthened, we need to invest in people. We need to invest in communities. We need to invest in local sources of food production. We need to invest in local workforce. We need to work closely with cross-sectorally, and which my other panelists have also mentioned, with other departments, to ensure that health is sort of a shared concern in the community, which it is, but it's also a shared point of bringing people together and action. And that's how we can achieve the purpose of universal health coverage and also protect ourselves from the disasters of climate crisis that it presents to us. Thank you.
Thank you, Feta. Great points. Running out of time, so we'll quickly move on to Christine. And Christine, we posed a few questions to you, like we did everyone else, and they were: how can the NIHR Global Health Research Centre contribute to attaining dual benefits of mitigating global environmental changes, improving public health, particularly for the most vulnerable communities, and what opportunities are likely to emerge in this area following COP28? Thanks.
Thank you. So first, on the dual benefits, just to recap for anyone who perhaps have heard less about the concept before, dual benefits is something that, for example, if we act on climate, we also create benefits for human health, or we create benefits for human livelihoods, or for something else. So it's essentially the dual benefits or the co-benefits concept, that by acting now on something that benefits one area, we are actually acquiring co-benefits for other areas now much sooner than perhaps our long-term goal would take place or effect. So, for example, we often talk about mitigating climate change by reducing greenhouse gas emissions, but also very frequently when we reduce greenhouse gas emissions from factories, from coal power plants, we also reduce air pollution, which benefits the health of communities that are affected by air pollution released through these plants. And there are other examples of that. Well, one thing with the co-benefits argument and the evidence that we have at the moment is that it's quite simplistic. And it's probably a bit too simple than it ought to be. Just a week and a half ago, we've launched a report in the Lancet called Pathways to a Healthy Net Zero Future, where we reviewed evidence of all actions that have been either modeled or implemented in practice that tackle climate change and at the same time also produce health co-benefits. Well, surprise, surprise, we arrived at kind of 4 main pathways that we've already known about: air pollution, diet, and physical activity. So these 3 pathways plus injuries, the 4th pathway. So these 4 pathways generate health co-benefits. So I already talked about air pollution. With diets, if we eat more sustainable and healthy food, we also typically would need to reduce our red meat consumption, red processed meat consumption, which benefits our health. With physical activity, if we cycle to work as opposed to driving, we also benefit our health already kind of now, and reduce our own risk of cardiovascular diseases. These are really good pathways, but the issue is that potentially there are many more co-benefits than what we've been able to summarize in this report. The aim of the report was to look at all of the actions that we have the evidence, so essentially all of the studies that looked and evaluated the dual benefit for climate and health at the same time. There is a much larger body of literature that is looking, for example, at agricultural interventions for climate change, but that literature has never evaluated some of their agricultural interventions in relation to health. So there's a gap in terms of the disciplinary connection. So, for example, how do we make sure that all of these agricultural interventions get evaluated simultaneously in terms of climate benefit and the health benefit? So a lot of work is going to be needed to bridge that disciplinary gap and make sure that the actions that have been proposed in one of the areas get also evaluated in terms of the other areas. So potentially from that exercise, we would acquire many more healthcare benefits that we would be able to recommend. And the next step after that is also think about, well, okay, these are the healthcare benefits that we know about scientifically, but what else can we think of? What else can we co-design? What can we learn from the local communities? Maybe there are more ideas that haven't really reached the scientific interest or the scientific literature, etc. So these are kind of the steps that we need to take. And the NIHR Global Health Research Centre is very well positioned to take some of these steps forward, given that we are going to co-design and implement interventions in 3 countries, India, Bangladesh, and Indonesia. All 3 intervention areas. In India, it's changing public food procurement systems towards health and sustainability. In Bangladesh, it's addressing the sort of water salinity, drinking water salinity issue, which is also related to climate change due to coastal flooding and saltwater intrusion into the groundwater. And Indonesia, we're addressing the plastic waste burning issue, which of course generates air pollution and negatively impacts human health. So all of these areas require interventions, and they require robust evaluation of interventions so that other locations can learn from actions that we come up with in these areas, implement, and see, well, how well they performed, to what extent can they be adapted elsewhere. And because of this interventional component and a large kind of scientific capacity to co-design, implement, and evaluate these interventions, we have the quite an unprecedented opportunity to think about what other healthcare benefits, apart from those that are very well known in the literature, can actually be produced. What's acceptable to the local communities, what is sustainable, so that the interventions don't get abandoned after 1 or 2 years after implementation. So hopefully we'll be able to come up with further evidence that will extend beyond these 4 pathways of air pollution, diet, physical activity, and injuries that we know about quite well by now. And in terms of the COP processes, I think, again, it's something that the NIHR Global Health Research Centre can certainly contribute with the best practice examples and essentially the cases of what can be done on the ground. We've seen this quite an extensive commitment by the health ministers and the health systems to become more resilient, to become more sustainable. But the next question is, how do we do it? And actually the answers to that that have been implemented, tested, and evaluated properly aren't that extensive. And any new examples will be definitely taken up very quickly by the community to learn and to understand what can be done in practice. So I imagine there will be a lot of eagerness to pick up our findings and learn, implement, and scale it up.
Great, thanks, Christine. So unfortunately, we're just about out of time, so we won't have time to take questions. But what we're are promising is that we'll look at the questions posted in the chat and develop responses to those and look to circulate those. We'll come up with a way to do that. So just brief reflections from me. I think, I mean, there's such an abundance of wisdom coming from the group. I'm going to expect that the inclusion of health within COP28 was absolutely positive. It got good sign-up, but reflecting on Christine's comment that actually there's a fall-off when we think about the number of countries turning that commitment to health into specific actions, tangible actions via the attached framework. So clearly there's some way to go. There's a great point by Sveta early on that we cannot adapt our way out of this crisis, and clearly we need to think and make sure that we move forward, have accountability mechanisms, and ensure that the mitigation agenda doesn't fall away, that's crucial in terms of health. Youth, a key constituents, and we're still struggling to think about ways in which we can include youth around the table of decision makers in an inclusive way. So Katia spoke to that in an eloquent way. The World WHO Youth Council is an important step, but there needs to be ongoing efforts to make sure that there's more democracy, more inclusion in that process, so we can make sure that all voices are heard. And we heard about the importance of primary healthcare strengthening, also from Sveta, that it's going beyond just responding, being resilient to climate change, but actually thinking in a proactive way how we manage the different types of risks and exposure that climate change is producing and the different disease burdens. And we heard about the importance of healthcare professionals that we've got 46 million, if that's correct, signing up to efforts to eliminate fossil fuels. So both inside and outside of COP, healthcare professionals have an important role to play. So I just wanted to finish by thanking the panel, excellent contributions, thanking the organisers, thanking everyone that's participating. Sorry I didn't get to questions. A reminder that actually tomorrow is Universal Health Coverage Day. The theme is Time for Action, and the emphasis this year is on the need for immediate and tangible steps following the 2023 political declaration on UHC. So without any more delay, we're slightly overrun. Thank you again, and look forward to continuing the conversation. Bye-bye.